We, students of Group A, are going to perform a role play on the title Addressing Non-Adherence, which is based on a case scenario where a 60-year-old man suffering from diabetes mellitus has come to hospital for his follow-up visit and he is not taking his medications regularly. Characters in this role play: Ashutosh as doctor, Aditya as patient, Anupama as patient's attender, and Nietzsche as the dietitian. Our story begins in the OPD where Mr. Aditya has come for his follow-up visit.
Good morning, Mr. and Mrs. Mayor. I hope you all are doing well. Mr. Mayor, recently I have been observing your blood reports and your blood sugar levels are higher than usual. Can you explain what could be the reason for that?
Actually, doctor is not taking his medications regularly.
Mr. Mayor, are there any issues with the medications?
No, actually the thing is I'm pretty busy. I don't have the time to take medicines. I often forget to take them, and to be honest, I don't think that medicines are worth it because they have not been curing my situation. Recently I've been feeling very weak and lazy, and moreover the medicines have been a burden for me economically. They are too expensive to buy, and yeah, those are all the issues I have with the medication.
Mr. Mayor, the issues you have mentioned are most commonly experienced by every person who is a diabetic. So we'll address the issue one by one. First, about the forgetting issue. Did you ever try to set an alarm or making a pill box? Or Miss Mayor, have you ever tried to make him remember to take medications?
I sometimes remind him of taking the medicines, but he doesn't agree to take.
Yeah, it happens with the diabetic persons because diabetic persons usually feel that they are okay, but diabetes is a very chronic disease. It affects very slowly, gradually, and it leads to serious complications. So you need to take medications regularly without forgetting, and you should take it as your responsibility. And for the third part, the financial part, we will try some alternatives. We'll try other drugs which are relatively affordable, and I'll arrange some other medications for you as well. Now I'll refer you to a dietitian because diet is as important as the medications that you are taking. So a dietitian will plan a strict diet with various nutrients and their composition so that you could also maintain a healthy lifestyle as well as take medications regularly. Thank you.
Good morning, Mr. and Mrs. Maher. I have discussed your case with Dr. Ashutosh. He has said everything. According to your case, I want to know what kind of diet you are following. So please let me know.
For breakfast, he takes idli,
Okay.
and for lunch and dinner, he usually takes rice.
Okay. That means you are taking more carbohydrates in your diet. That has to be reduced in your case, means diabetes. In diabetes, carbohydrates makes more difference than usual. So I'll suggest you some diet chart that you have to be followed. Means you have to replace your carbohydrates with more protein and fiber. You have to take care of them, and you have to reduce carbohydrates and fats. So that's must. If you take more carbs and fats, that will be very dangerous to your condition. That will complicate your condition. I'll suggest you some foods which contain more protein and fiber. Protein like eggs, pulses, soya, milk, paneer you have to take, and fibers like fruits. You have to replace more fruits in your diet. Leafy vegetables like spinach, etc., etc. And you have to reduce the rice amount and sugars. You have to take less sugars and fats. And you have to change your lifestyle too. If you are sedentary, you have to do exercises too, and take medicines regularly. Take this diet regularly. And thank you.
This brings us to the end of our role play session, which highlighted on a common but a critical issue, that is non-adherence, which means the patient doesn't follow up to his prescribed treatment plan or health advice. This might be intentional or non-intentional. Intentional because of its poor or low socioeconomic status, side effects associated with the medicine, or he might have any cultural belief of taking traditional medicine. Unintentional, which might be forgetfulness or misunderstanding between the doctor and the patient regarding the treatment plan. If it is not addressed, it may result into poor disease control and early onset of complication. Thank you.